name is Frank, and I'm here to present on dental caries, an interesting topic. A lot of people do not understand why a tooth should have a hole. Today we are going to digest what it is and then what we can do about it. As a little experience I've gathered in my practice, I've realized that in the dental facility, the most common or the commonest disease that people present is dental caries or hole in the tooth. So today we're going to talk about caca, also known as dental caries. This is simply getting to have a hole in your tooth, and it is not an event. It doesn't happen suddenly, but then it's a process. It starts from somewhere and then ends up having a hole in the tooth. And so to start with, in my little definition, I've made it this way. It is a permanent damage that happens to the hard tissues of the tooth. In other words, there is a damage that happens to the hard tissues of the tooth. When I talk about the hard tissues, I mean the enamel, the dentin, the smelt. These are the hard tissues of the tooth. And when there is a permanent damage to them, it means something happens to them and they cannot repair. The body cannot repair by itself. And so you have a hole in the tooth. There are certain factors or there are certain causes of this very disease that attacks the hard tissues of the tooth. One, there should be tooth in place, because without tooth, you cannot have a hole in a tooth. So anybody who has a tooth in the mouth is or would or can have what we call dental caries. So the moment there's presence of teeth or tooth in your mouth, then that tooth is susceptible or becomes liable to dental caries. Secondly, there should be microorganisms in the mouth. So these microorganisms are the normal flora, normal organisms that God has created to protect our oral cavity. But in one way or the other, they find themselves causing harm and aiding in cavitation of the tooth. Thirdly, there should be what we call substrate or fermentable sugars or carbohydrates. So remains of food debris in the mouth. So when there is no food debris, if there's no refined sugars or fermentable sugars, carbohydrate products in the mouth, dental caries cannot occur. It's as simple as that. So I have mentioned 3 things. And then the 4th thing I'll talk about is frequency. So how often do you take these substrates? How often do you take these sugars? How often do you take these sweets? How often do you take these carbohydrates? Are the ones that are going to determine whether you would have a hole in your tooth or not. Whenever the pH in your mouth decreases, then you are getting closer to having a factor that may propound the phenomenon or this kind of process that I'm calling dental caries. And so it is very important for everyone to know how it occurs its consequences, and the rest. And so there are certain factors which are termed risk factors that will make all these factors, all the causes that I've mentioned, play a very important role in getting dental caries. So in the next episode, we are going to talk about these factors and how they also aid in getting dental caries. However, this is Divine Smart Dental Care, and so don't be scared about caries when you are in our hands. Irrespective of the stage of it, we are going to have a remedy for you to be free from holes